Insane asylums were first created in the 17th and 18th century. There were no rules and regulations for how people with mental illnesses were treated. People with mental illnesses were considered crazy and dangerous. Insane asylums were created to remove those members from society. Physical and mental abuse was commonplace, and widespread use of physical restraints, including days on ends in straitjackets with heavy arm and leg chains. These deprived patients of their dignity and
19th century reformers such as Philip Pennell and Dorothea Dix made great strides in promoting humane treatment of those with mental illnesses. However, conditions were still far from ideal.
A Mind That Found Itself, written in 1920 by Clifford Beers, highlighted the struggles of mental institutions in America. The book is an autobiography depicting his battle with mental illness and the shameful state of mental health care in America. A Yale graduate and young businessman suffered an acute breakdown brought on by the illness and death of his brother, then was put inside a mental institution.
The book sparked the foundation of the National Alliance of Mental Health in 1950. Through television programs, literature distribution, and other media techniques, the Alliance continues to educate the American public on mental health issues and promote mental health awareness. This helps to reduce the stigma of mental illness in America and helps Americans understand and sympathize with affected people.
This association helped influence the passage of the Mental Health Systems Act of 1980, which was during the presidency of Jimmy Carter. The act fostered the continued growth of America's community mental health centers, which allowed individuals with mental illnesses to remain in their home communities with minimal hospitalization. In 1990, the National Alliance of Mental Health played a leading role in the development of the Americans with Disabilities Act. This act protects mentally and physically disabled Americans from discrimination in areas such as employment, public accommodations, transportation, telecommunication, and state and local government services. In 1996, the Mental Health Parity Act was passed. This act was a great victory, preventing insurance companies and large self-insured employers from placing annual or lifetime dollar limits on mental health coverage. The act allows for better treatment for low-income patients with mental illnesses. Today, there are no more insane asylums, but instead psychiatric centers. These centers have a more comfortable atmosphere to foster support and growth. Treatment is now delivered through a web of services including crisis centers, short-term and hospital-based psychiatric care units, and outpatient services. There is a range of treatments, from medications to therapeutic treatments. One of the most successful psychiatric centers in Maryland is Sheppard Pratt. Sheppard Pratt treats patients with schizophrenia, eating disorders, depression, autism, anxiety, Down syndrome, Alzheimer's, dementia, and many other mental illnesses. Today, a quarter of Americans have been diagnosed with a mental illness. There have been 59.2 million visits to a hospital with mental disorders as the primary diagnosis. The stigma of mental health illness is still prevalent today. Although there has been much progress made about the treatment of mental illnesses, there is still work to be done. There is much uncertainty about the causes and treatment of mental illnesses, but research and education continues to advance doctors' knowledge and the patient's quality of life. Former First Lady Rosalynn Carter is a strong advocate for the equal treatment of people with mental illnesses.
I'm pleased to introduce this special theme issue of the American Journal of Public Health, focusing on stigma and discrimination against people with mental illnesses. New research on the topic has exciting implications for public health and for mental health policy. Having worked in the mental health field for more than 40 years, I have seen firsthand the detrimental effect that stigma and discrimination can have on a person's recovery. Every day, the stigma attached to these illnesses causes people to hide their conditions and not seek help out of fear that they will be ostracized or discriminated against by their employer, even by their family, and by their community. This is tragic because we know that effective treatments exist and that the vast majority can recover and lead productive lives. With 1/4 of Americans affected by mental illnesses every year, it is fitting that this journal has devoted this special theme issue to the important role stigma plays in overall public health and in wellness.